Endometriosis and fertility. Today we're going to look at endometriosis and impact on fertility. We're going to discuss some few important points. Getting pregnant with endometriosis, is it possible? That's the question. Yes, endometriosis is a tissue similar to the endometrium growing outside the endometrium. Example of where you can find endometriosis, it may be in the ovaries, it may be in the fallopian tubes, it may be in the peritoneum, it may be as well in the intestine and the bladder. How does endometriosis affect pregnancy? A review of 2014 study shows that 2 to 10% of couples living with endometriosis do succeed in becoming pregnant. However, 15 to 20% of couples without endometriosis as a complication do get pregnant. Therefore, if you look at a person with endometriosis, the chances of getting pregnancy are lower compared to a person without endometriosis. Now, what are the fertility issues which may come due to endometriosis? Endometriosis may affect your ovaries. In other words, it's a lesion which can grow in your ovary and then disturb certain function which the ovary is supposed to do. Which are those functions? Ovary is supposed to manufacture eggs, what we call the oocytes, which are supposed to be released. Then endometriosis may interfere with that and cause you not to ovulate. Even if you ovulate, the egg's quality may be affected and be poor. Endometriosis may affect the tube by damaging the fallopian tube itself due to inflammation and fibrosis, blockage, and adhesions. Therefore, it's very important that most of the patients who had ectopic pregnancy during the procedure or the surgery to really look what may have caused that ectopic pregnancy. It's what most of us, we're not at that level of management, which is very important, that when you do surgery and you find out the patient's got ectopic and is to look around what may have caused this ectopic. And you've got an answer, you can deal with it properly, but still it's very important to tell your patients that what may have led to that ectopic pregnancy. As I said, ectopic pregnancy is common to patients who have endometriosis. Damage to egg and sperm may be caused by inflammatory process associated with endometriosis. Distortion and destruction of pelvic anatomy due to fibrosis and inflammation. That's the mechanism in which endometriosis causes infertility in most patients. When to speak with your doctor if you have really endometriosis. If you started having problem to conceive, trying probably for a year and nothing happened, it's very important to approach your general practitioner to really find out. And if there is a big suspicion of endometriosis, then you can be referred to a fertility specialist. Severe pain or dysmenorrhea, which is a painful menstruation, also may be the cause, may be caused by endometriosis. Dysgeusia, painful urination as well, and also chronic abdominal pain sometimes may be misled to be ectopic, to be appendix, or bowel problem and so forth. Therefore, it's very important to get a good diagnosis early so that you can see that how to work yourself out during reproduction. Now, surgical endometriosis treatment have good outcome. if it's done by a fertility specialist or an expert in endoscopic surgery. That's very important. If the first surgery of endometriosis is not done correctly or properly, patient have to have a problem of having multiple surgery, which are not able to actually achieve the main goal, either pain or to get to pregnancy. Therefore, it's very important that selection of your surgeon is very important so that a good surgery can be done and then your reproductive career can be okay. How to assist a patient with endometriosis, which is causing infertility or difficulty in getting to pregnancy. Especially if you diagnose a patient with endometriosis stage 2 or 3, stage 3 or 4, it's very important that freezing of your eggs be actually on the agenda and discuss it with your fertility specialist, especially if you're not planning to get pregnant, so that later you can use those eggs to get pregnant. Superovulation and intrauterine insemination is one method which you can be assisted with, where you get medication so that you can ovulate. If you remember, I said endometriosis may affect ovulation as well. And then fertility medication, which may be injections on oral, is very important. Then ovulation induction as well can be used. And the most important and commonly for stage 3 and 4 of endometriosis, IVF is more recommended for those patients. IVF is recommended for people with moderate to severe endometriosis. It's very important if that diagnosis you have, and you must know that most likely or your chances of getting to pregnancy are higher if you use IVF. People with endometriosis do have successful pregnancy, especially through IVF treatment. Therefore, that's an important information which I want to leave you with today.